Hi everyone, my name is Beth Corner. I am a nursing faculty at an ADN college in Michigan, and I really wanted to talk about some of the exciting things that our nursing program has transitioned to in the last couple of years that we found has been very successful to the students in getting them more practice ready as they enter into nursing practice, right? So I really want to talk about getting rid of that dreaded clinical paperwork. So, I don't know about you, but when I started nursing school, I had care plans that were due, and sometimes they were 20 pages long. And I remember staying up for hours and collecting data and submitting paperwork and often getting graded based on that clinical paperwork. Well, I'm not sure if that clinical paperwork is as relevant today as maybe we thought it was many years ago. Here's what I mean. Several years ago, we started flipping our classrooms, right? We started flipping the classrooms. So our application was brought into the classroom by bringing in patient scenarios. I think that was step one. And now I think we need to flip our clinical experiences and get rid of the clinical paperwork. And instead of grading on paperwork, we grade on performance. So let me explain how this came about. So I was a firefighter paramedic before becoming a nurse. And when I went into those courses, we had classroom instruction and clinical experiences, very similar to nursing. And you had to go to the class, take all this information, and then when you went to clinical, you actually performed the task. You did not collect data, you did not submit paperwork. There wasn't any of that. So for instance, if I was in one of my firefighter classes and I had to learn how to sweep a room, meaning I had to go into a dark room and look for possible victims on the floor, I put on my turnout gear and they blacked out my face mask and I crawled around on my hands and knees and I searched for patients. And then you had to haul them out. And that was the application. You performed the task. And not only perform the task, but you had to critically think through the situation and the challenges you were presented. Now, I think we're missing that a little bit in nursing because we do go to clinical and we do take care of patients, but I wonder if we're taking care of them to the extent we think we're taking care of them. So I had a student getting ready to graduate, and the student had been taking care of a patient with a sodium level around 110. And as we know, that sodium is way too low. And it leads to, or has a potential to, cause that patient to have seizures. And so that patient should be in seizure precautions. Well, halfway through the day, that student did not put them into seizure precautions. Now, when I pulled the student aside and I said, what's a normal sodium level? She could say, yep, 135 to 145. Well, good. Well, what does that indicate? Seizure precautions. Okay, what are the seizure precautions? And she could list them off, like a select all the apply. Well, I don't know about you, but I don't have any patients, and I still take care of patients at the bedside. I have no patients that have a pick list over their head. I don't have any select all the applies over their head. And I can't come back 2 days later to look it up and then put them in seizure precautions 2 days from now. So our nursing faculty got together and we said, you know what? We have got to do something different. There's a gap. We need to flip our clinical setting and start grading on performance, the application. We taught them the application. We brought in the scenarios in the classroom. But they weren't bringing the classroom into the clinical because all they had to do was submit clinical paperwork and say, yep, I'm a 4. I'm perfect because, yep, 2 days later, I can tell you that they need to be in seizure precautions, but yet they didn't implement a darn thing. So we took the clinical paperwork away. Guess what? Now our students are applying. Our students are no longer spending hours collecting data. Instead, they're spending hours taking care of patients. We're using Tanner's model in the classroom and in clinical, and they're working through problems in real time. If they're not meeting their outcomes, they know it in real time. At the end of the day, our patients are safer and our students are more practice ready. So I wonder if your program can look at what you're trying to achieve, and can you also get rid of clinical paperwork?